Welcome to The Blend, a podcast brought to you by the Journal of the Dermatology Nurse Practitioners and Physician Assistants. In this episode, Dr. Sonal Choudhary and Physician Assistant Noel Prevost discuss changes to the iPLEDGE program and share tips on how they counsel patients on Isotretinoin regarding risks.
Welcome to our advanced practice providers, physician assistants, and nurse practitioners and physicians in dermatology. We're taking it another step forward today by discussing some of the important therapies in acne management, which are unavoidable in our conversations with our patients. Isotretinoin was something that we wanted to go into more details of. Now, coming to that isotretinoin that we had promised to talk about, as an expert in that area, what are the most recent updates around iPLEDGE and the clinical use of isotretinoin that you can tell us today?
So they did make it a little bit more easy on the provider. So a couple of things. They made it a little bit more inclusive, thankfully. So what they changed the terminology. So now they use people who can and cannot get pregnant, where they used terminology about, childbearing potential versus non-childbearing potential. So that was definitely helpful, especially for a lot of our trans patients. The other thing is there is no more of a 19-day lockout period. That was extremely frustrating. I'm sure if any of you, which probably most of you, isotretinoin. It was very, very frustrating because you had to, really follow the patient. You had to, tell them come back in after 19 days and then trying to schedule an appointment and getting them the pregnancy test. So that was really frustrating. So they did get rid of that. So that's really important. They did allow for the initiation of home pregnancy tests. I think around COVID, what they ended up doing is you were able to continue doing video visits. So you were able to upload a urine pregnancy test. But what you have to do first is when you first initiate isotretinoin, they do want you to have either a lab pregnancy, like a lab draw, or an in-office urine pregnancy test to get them registered and started before you can then start doing the home pregnancy test. But that was really helpful. It's also very helpful for video visits. Patients don't have to come into the office every time. And then I'm trying to think what else. Those are like the main things that were kind of really helpful in the updates. Otherwise, I'm trying to think a couple other things just to think about. So hysterectomy, patients would be considered as unable to be pregnant or become pregnant. So that's good to know. Just make sure you document that in your chart that they have a history of a hysterectomy and they cannot get pregnant. And then ablation and tubal ligation, that is something to pay attention to. They still are considered potentially fertile. That's something that it wouldn't be 100% not able to become pregnant. So that also needs to be documented. And then other things, as most people know, if they're prescribing isotretinoin, no blood donation, no medication sharing. And then in regards to cosmetic procedures, I was reading a couple articles, they're saying if you're doing minor cosmetic procedures, it can be typically safe after 4 months of post isotretinoin, but it all depends on the person who's doing the procedure. So if you're doing any cosmetic procedures, talk to the provider if they feel comfortable, doing a minor procedure about 4 months post isotretinoin. The reason being is I always advise my patients to wait the 6 to 12 months because isotretinoin can delay healing and can increase your risk for scarring, which you definitely don't want to do that or increase that risk after you just completely cleared your skin. So, deeper procedures where you're going kind of deeper into into the dermis, they definitely recommend nothing until about 6 months or later. But something that's like real simple, some providers might be okay with doing it.
Thank you for that. That's a great update. Now I'm going to ask you a question that has two questions in it. The first is, what about things like inflammatory bowel disease? How often do you bring it up? Or like a psychiatric history for your patients? Like who are the contenders for, and being included for an isotretinoin treatment? Also, do you highlight any specific precautions or advice when they are about to start it? Like, hey, you must keep some eye drops handy, any specifics on those things. So you must moisturize your skin because it makes you dry. So what are those two aspects that you talk about in your exam room?
So in terms of, so when I see somebody who's going to potentially start isotretinoin, I do have a list of things I do ask. So with IBD in the studies, I actually, I think I was an author on one of the articles we published. There really is no causal link between isotretinoin and IBD. But I always like to ask, because if they do have IBD and you're on isotretinoin, there is a risk that it could worsen the IBD. So I've had a couple patients who had a history of it. I got approval from their GI doc. A lot of times a lot of my patients have done well, but there are some patients that they can have a flare. So I think having a history, like, hey, do you have a history of IBD? Is it controlled? Get a letter from GI, then you should be good to go. Now, isotretinoin causing IBD, again, in the literature, there's no causation, and what they're thinking is it's more the oral antibiotics that might be driving the IBD versus the true isotretinoin. So if they have no history of IBD, I don't have an issue with putting them on it. If they do have a history, I do get a letter from GI, but I do kind of mention it to them, but I also mention that there is really no causal link. But if they do have any GI issues, please let me know. A lot of the GI issues that people have complained about, it's not truly GI, but they'll have a little bit of blood on their toilet paper after having a hard bowel movement, because sometimes they'll get a little constipated with isotretinoin because they're just like so dried out, or not really. If they're constipated, their skin's really dried out. The mucous membranes get dry, so then that increases their risk for a little bit of tearing, post bowel movement. So that's that. In terms of psychiatric history, I do ask them any history of suicidal ideations. Have you been hospitalized? Are you on any antidepressants or any antipsychotics? The reason being is I do proceed with caution with bipolar disorder. There's several case reports of it flaring, isotretinoin flaring bipolar. So first and foremost, I will also get a letter from their psychologist or psychiatrist, because I need to make sure that they're also aware, their provider is aware that we are going to potentially proceed with isotretinoin. And my patients who do have bipolar disorder, I had a patient who wanted to commit suicide because their acne was so bad. So I did work in conjunction with their psychiatrist to make sure we monitored them very closely. I started them on a very low dose. And so we just kind of, monitored extremely closely with this patient, and she did okay. However, I had a couple other patients that did try to commit suicide on isotretinoin. So that really made me proceed with caution moving forward with my other bipolar patients. But depression, anxiety, ADHD, I don't have any issues. I do get a letter from psychiatry or psychology, or sometimes the PCP, whoever's treating them with their medication, to confirm that they are stable and everything's good moving forward. But again, in the literature, there's really, again, no true causation between isotretinoin causing psychiatric issues. But in some of my patients, I've had some mood changes, but it was hard to decipher, was it, because a lot of my patients are students. So it was hard to say, are they homesick? Are they dealing with situational issues? So that was kind of hard to tease out. But clinically, a lot of my patients they do fine. And it's mainly the bipolar disorder that gets me a little anxious. And then I'm trying to think other things that I do have conversations with them.
How do you guide them with their treatment, actually? Like when you say, well, these are the things you will have to kind of start thinking about, keeping your skin moisturized, or like even increasing your fiber maybe because they're dealing with some constipation, that kind of thing.
Yeah, the classic things that I do is I tell them, moisturize daily, SPF 30 daily for most of the patients, because again, isotretinoin is extremely photosensitive. I do talk about Aquaphor, Vaseline for the lips. Most of the other chapsticks and other things like that are really not effective. Eye drops. I do also ask them about contact use, because isotretinoin can cause decreased meibomian gland function. So it reduces kind of the tear film, so increases your risk for dry eyes. So I do recommend that they use re-wetting drops preservative-free, which they can use up to 4 times a day. If they have a preceding eye issue, like say they have dry eyes to begin with, I will have them consult their ophthalmologist before starting on isotretinoin to reduce risk of potential corneal abrasions, because if they get too dry, they can potentially develop corneal abrasions. Other things, I do recommend sometimes omega-3s. That sometimes is really helpful in some of these patients, particularly if their triglycerides are a little elevated. And then so some patients, if they take it during the summer, they have a risk of sunburn. So that's something to talk to your patients about. And I sometimes advise them not to take it until the fall if they predominantly have a job that's outside, or if they're an athlete and they're playing their sport outside, or if they're going to be away, a summer abroad somewhere that's sunny, just because you want to really minimize their sunburn risk, because chronic sunburns can increase your risk for skin cancer, particularly in the fair patients. And so I'll a lot of times recommend doing it in the fall. Now, the fall and winter, the downside is if you have a history of eczema, it can, your eczema can worsen, or you can develop a retinoid dermatitis, which, classic areas are on the tops of the arms, tops of the hand. You'll start seeing it. It just looks like almost like an eczematous type of dermatitis. And it's not an allergic reaction, and it clears really nicely with topical steroids and moisturization. So those are some things I talk about. I do tell them to limit alcohol, or I recommend limiting alcohol. That is a conversation I have a lot with my college students, because the thought of like, oh, I just have a couple beers. Typically, it's not just a couple beers, because a lot of times I'll notice in their blood work, their liver functions will increase significantly, and their triglycerides will increase significantly. And so that's a way to tell that most likely it's probably alcohol, because alcohol can do both. So I'll have a conversation and say, hey, listen, just limit your alcohol. Accutane can be potentially hepatotoxic. So I do have that conversation. And a lot of times they're very compliant, because they really want their skin to clear. And I have them not use anything on their face, no acne treatments, and just gentle cleanser on their face during the course of isotretinoin, along with a sunscreen.
Thank you, Noel. That is pretty comprehensive. Some of the older things that have stuck around is the fact that, you cannot donate blood or share your medications on isotretinoin. So that those are things that have been there, part of iPLEDGE for a long time. I think these were some amazing pearls of wisdom from your long-term experience in this area. And this will help provide better, well-rounded services for acne for our listeners if they want to incorporate any of these tools, whether it's a patient who has polycystic ovarian syndrome, or, it's a cisgender or transgender patient, and a range of options and ideas and suggestions. Definitely talk about the dietary intake, their sugar intake, etc., in every single form through your history and examination, and ask questions, ask a lot of questions, because you will get some answers there. Also, guiding their isotretinoin treatment safely can be such a great experience for the patients, because it can otherwise be rough if we are not supportive and we don't have all this good information for them. So I really thank you for your time, Noel, and sharing all of these detailed informations. We really welcome questions from on our podcast, and we are very happy to answer any questions or comments that we receive. Until the next time, thank you so much for listening.
Thank you.
We hope you enjoyed this episode of The Blend. Thank you for listening. We'll see you back next time.